Welcome to Conarock Healthcare's Handoff Introduction. We're going to go over the basics of our patient handoff application and how your organization can leverage technology to improve productivity and patient outcomes. Miscommunication between caregivers is a critical issue, involved in an estimated 80% of all serious medical errors. Effective and clear communication between caregivers during the patient handoff process is key to preventing those errors and improving patient safety. Failure to provide clear and consistent communication during the patient handoff can lead to delays in patient treatment, improper treatment, omission of care, and adverse events, all of which increase patient risk and cost of care. To help address these issues, many organizations have adopted standardized forms and checklists, such as SBAR forms, which provide key information and list critical elements in a consistent and meaningful format. Typically, these documents require information that must be synthesized from multiple sources, resulting in a tedious and time-consuming process for caregivers. When caregivers prepare and transfer information from multiple patients, it's not hard for some details to get lost or fall through the cracks, potentially leading to adverse patient events or delayed care. That is where Conarock Healthcare's Handoff comes in. Handoff handles the sourcing of patient data from multiple locations and automatically formats it into a familiar SBAR document, allowing caregivers to see at a glance what a patient's status is and easily attach notes for follow-up care. Handoff is a modern, multi-platform application with a simple and easy-to-use interface, so caregivers can focus on what is important. When you first launch Handoff, you will see the login screen where you enter your username and password. This screen also allows you to select a site to log into if your organization has more than one site. Once you have logged in, the dashboard screen will load, and you will be presented with the census for your selected site. Handoff's dashboard screen consists of three major sections: the ribbon bar, the context menu, and the patient grid. The ribbon bar is where you can access different modules of the Handoff application, and also where you can access the context menu. The context menu allows you to select the site and unit combinations that you would like to see data for. This makes it easy to locate specific patients or to view entire categories of patients for a given site or unit. The patient grid is where you can view the current census as well as basic patient information. The patient grid supports a wide variety of filters and sorting, allowing you to quickly find the information that you are looking for. If you see a patient in the grid that you would like more information on, you can simply click the patient name and Handoff will open the patient detail view. The patient detail view shows you all of the available data for that patient and also includes each patient's handoff information. The patient grid's first column is to toggle the hot list status for a patient. To add or remove a patient from your hot list, simply click the checkbox for that patient. All patients that you have in your hot list are automatically prepared for transition to the next shift. Once you have a hot list set up, you can click the Handoff icon located on the ribbon bar to start the Handoff module. The Handoff screen displays each of your hot list patients in a tab where you can highlight care items or enter notes for other providers to see. As you enter notes or highlight care items, each patient's state is automatically saved, so changes you make for a patient will show up for any other provider who opens that same patient. The Handoff view also shows action items, such as overdue care items and out of compliance and high risk factors, such as sepsis or acuity scores. Since all of the patient information is updated in real time, there's no need to perform any other steps. As soon as you update a patient record, other providers can instantly open that patient and view the up-to-date status. That concludes our Handoff introduction. If you would like more detail on any particular element, please contact us today.